issues. And that doctor would typically just say, you know what, I want to schedule an MRI because we want to take a very serious look at what's going on here. If you have original Medicare, he simply writes the order, places it with where he wants you to go, and original Medicare pays the claim when it arrives. If you have a Part C Medicare Advantage plan, that physician typically needs to get a prior authorization from the insurance company before you go have that fairly expensive MRI. And they may even ask, have you had an x-ray first? So again, it looks very different than kind of the way original Medicare manages as you need different things for your health. The most complicated part of Medicare is the prescription coverage. It's called Part D. And since the Affordable Care Act passed in 2010, there's been some pretty substantial changes to the way Part D Medicare prescription coverage works. Every year during Medicare open enrollment is your opportunity to review that. If you haven't done it in a while, it's a very good idea to do it. NIA and Lifescapes and a number of the area aging councils provide that service for free. Williams Manning Insurance Group also does that. So if you haven't taken a look at your Part D this fall, October 15th through December 7th is your opportunity to do that. And if you're in one of those Part C Medicare Advantage plans, that's also your time to take a look at what that plan looks like for 2017, if you want to stay in it or go back to original Medicare and select some other type of coverage. And I just spewed out a whole lot of stuff. Did I generate any questions for the audience? Oh, we got a hand up. Yay.
Which one is the best one for you?
Oh, that's an excellent question. That's a very specific decision. It ties into a number of combinations of things in your life. Some of it's financial, some of it's health driven, and your prescription costs can play a major factor in that determination. When we sit down with a client, we look at all options at the same time, and then we ask a lot of questions. We drill down in and find out who your favorite hospital, favorite doctor, and identify the plans that would fit those needs, and then basically help you make an educated decision. But typically in the Rockford area, currently about 68 to 69% of people go original Medicare with a supplement. So that leaves a smaller portion in those Medicare Advantage plans. The reason for that is it's not a perfect fit for everyone, as I'm sure your dear friend over here could attest to with her aunt. Yes, an additional question?
Yeah, so what is a supplement? You gotta have that when you go to Medicare?
You do not have to have a supplement, but it is an optional piece of private insurance that basically comes behind Medicare A and B and picks up what Medicare doesn't cover, because Medicare is not 100% coverage. You're welcome. And there's multiple plans in different companies and different price ranges. There you go. You're doing research,
What age does Medicare begin?
Medicare typically begins at age 65. However, there is a percentage of the population that becomes Medicare eligible, as we refer to it, due to disability or to certain types of illnesses. Specifically, someone with what's called end-stage kidney disease, or you're on dialysis, or Lou Gehrig's, and there's a number of other diseases that cause you to become automatically Medicare eligible. But typically, it's age 65.
Thank you.
My question is, they make a difference in a hospital. Now, I'm a heart patient, and I got a letter from my heart doctor that said that they no longer will see me at Sweet, so I would have to go to either St. Anthony's or Rockford.
Does your current coverage, is it Medicare, original Medicare, or are you in a Medicare Advantage? No, the hospital will not make a difference in your case. Because when you have original Medicare, your network is Medicare. So you can go to any hospital, any doctor, anywhere in the country, as long as they accept Medicare or Medicare coverage.
What I'm saying is that my doctor wrote me a letter that they will no longer see me at Sweet.
But he will see you at one of the other hospitals?
Yes, yes.
Then your original Medicare will cover those hospitals.
We do have one more panelist to join us.
Oh, excellent.
You're welcome to join the table.
What's the difference between having, I have Medicare,
Uh-huh.
Blue Cross. Now why do I need a supplement? Because we look about Medicare, don't pay, like, 80% for that.
Uh-huh.
Every once in a while, they ask me for that amount, the money, 20 cents.
So the Blue
So it's
Cross,
good to have supplement.
yes.
Even with the two insurances I have.
What type of Blue Cross plan do you have?
Blue Cross Blue Shield, and Chrysler.
Retiree option. Okay.
Okay.
Yeah, that's a totally different animal. When one has a retiree option that coordinates with Medicare, it could have a small amount of what I call out-of-pocket or a small copay or co-insurance. So what you've got is basically from your retiree package from your employer, you are provided with additional health insurance that goes with your Medicare, but it's not 100% coverage. And in that case, you would not want to put a Medicare supplement with it because you would lose your retiree option.
I guess I just still pay a little out of pocket.
And unless it reaches the point where financially it makes sense to make that switch. But to be very honest with you, I haven't seen a retiree option in years that you would want to replace because you earned that benefit through your years of service with that employer.
Okay, thank you.
You're welcome.
Would that be something that perhaps she might want to meet with you about to look at her
Yes.
plans to see if it would
If it would make
benefit
sense.
her
Mhm.
to stay with the current coverage or to add a supplement or replace?
That's an excellent question, and yes, we do that type of review all the time. Typically, retiree plans that work with original Medicare are also tied to Medicare open enrollment. They may not be, but in most cases they are. So in that fall enrollment period, we get a lot of people with retiree plans that want to review with what they could do on their own. And we do that. And by the way, I don't know if I mentioned this, but all of our services are free. So there's no cost to meet with one of our advisors.
Thank you. And any other questions on this side? I'm gonna go back over there, but I just wanted to see, did anybody have any questions over here?
You guys have excellent questions, by the way. A lot of thought process going on out there.
Just want to get something clear, probably answered already, but again, I'm with Medicare Advantage, retirement.
Right,
Health issues have been really increasing a lot.
okay.
Just wanting to know, would I be eligible or should I consider a supplementary plan because the bills have really been coming in?
If you're reaching a point, excuse me, where it might make more sense for you to pay a premium monthly to a Medicare supplement plan instead of the Medicare Advantage plan, we can show you those numbers. And there's a tipping point in dollars and cents where it does make sense to make that change. It's very common that we may start out in one plan at retirement or at Medicare age at 65, and over the course of our aging process, make a change. So it happens all the time. Now, if you've got your plan through an employer, you're going to have some form of enrollment period tied to that when you can make that decision if you want to leave it. It may be that Medicare open enrollment period or may not, but you typically get a packet in the mail that says this is what the new plan for next year is going to look like. That's a good time to schedule a time with an independent broker, and we would love to see you if you want to come to Williams meeting, that can sit down with you and show you what's available on the individual market on your own versus what your employer's offering.
Well, the premium and everything is really great. I don't know if I can do anything better. But again, I was interested in something supplemental, basically to kind of ease
The major out-of-pocket. There are actually individual products available to do just that. And it's not a Medicare supplement. There are products out there like a hospital indemnity plan or basically pieces of insurance that are designed to help where you have a Medicare Advantage plan. It's called a GAP. type plan that are fairly low cost typically. And when you're seeing those larger out-of-pocket amounts, it might make sense to have a smaller monthly premium to protect against that. So there is options out there.
The question about when can you get Medicare?
Yes.
You said certain different things that you can have that you might get it earlier.
Right.
How do you find out? Is there a number you call or somebody you talk to about to find out if you are eligible?
Well, if you, excuse me, if you qualify for Social Security disability within 24 months of that determination, you are automatically Medicare eligible. The diseases that cause that automatically typically is handled on diagnosis. So for example, if you were at your doctor's office and told that you had ALS, there's usually a social worker that steps in at that point that advises you the process to get Medicare in place. But there are groups out there that assist with that type of thing, and Lifescapes is one of them, to see if you qualify for some other type of way, yeah. As well as Medicaid, and the show lady's going to speak on that.
Are the supplementary plans expensive, or how do you determine how much the person have to pay?
Excellent question. Medicare supplement plans are in fact private insurance, so the rates are going to vary depending upon the company that you're looking at. They are tied to your age, your gender, and where you live. The where you live is because of the cost of care in the area where you reside. So for example, out here in Rockford, we're about 30% lower in cost on our health care than we would be if we were in Chicago. And across the country, that varies a lot too. So at your age that you are and where you live and whether you're male or female determines what the rates are. However, there's a lot of companies out there, so it's a really, from a consumer standpoint, it's easy to shop and find a good plan and make sure you're getting the most competitive rate. I don't know if that specifically answered, but to give you a specific number is really difficult without an age and a zip code.
Okay, thank you.
You're welcome.
And also, how do you set up an appointment to meet with you?
I have my business cards with me, and I'd be happy to provide you with that contact info.
Okay, thank you.
You're welcome.
Are there any other questions at this time? Okay, so then we'll transition and allow Melinda to introduce herself and talk about Medicaid. And then we'll allow Antoine to introduce himself and talk about the industry of healthcare that he serves individuals.
Good morning. Can everybody hear me? Perfect. So my name is Melinda and I work with Crusader Community Health. The role that I play there is outreach and enrollment, so I actually work. Okay, I'm sorry. So I work within the facility as well as going out to facilities and organizations in the community to assist consumers as needed. The organization that I work for, we work with Medicaid as well as the federal marketplace. So with the state, I want to apologize ahead of time because the state, we're currently broke, as everyone knows, and so as a result, we've had some positives as well as negatives. The positives are with the ACA, the implementation of the ACA. Now the criteria has changed. Previously, an individual would need to be a pregnant woman that was caring for a child or someone that is disabled. But now, because the rules have changed, anyone ages 19 to 64 are eligible. We do have a huge population of African Americans that have not applied for Medicaid, and now is actually the time to get that coverage. So I provided a handout and I tried to condense it as much as possible just to make it more digestible and just to kind of highlight some of the important parts of Medicaid. And so basically, again, I just put a snippet, the ACA, some of the rules and eligibility that goes into being eligible for Medicaid. It still primarily focuses on income and a person's immigration status. So you have to fall within a certain income bracket depending upon the amount of individuals inside your home. I kind of put in there some income that is considered. There are variables that are taken into consideration. And then immigration status, that is one that is significantly important here since this particular population is very diverse. You have to fall within a certain the immigration parameters in order for one to be eligible. On the next page, I'm kind of skimming through as to not take up too much time. Okay, so the application process. So our local office has relocated to Mulford and East State, so no longer people have access to the facility on 11th Street. Avon Street. But you can go, Crusader Community Health processes applications. I know that there's a facility off of Church Street that processes applications. Once you submit the application, it takes about 45 days for the Medicaid application to be processed. Now, if you submit an application for SNAP benefits, then that reduces the amount of time for processing. It's typically followed up with a letter. If additional documentation is needed, provide that information. We help with photocopying, help with the application process, redetermination process. We do quite a few things there. SNAP applications, there is a parameter, but we typically find that a single individual who falls within a certain income bracket is eligible for SNAP benefits. So that's a good thing as well. Once you are approved, this is where it gets a little difficult. And so Crusader is able to walk you through that process, however long that takes. So once you are approved, there are some individuals who will not receive an approval letter or will not receive the traditional Medicaid card, which is double-sided. So we are able to do the research to see whether or not you are approved or denied. We actually have local caseworkers that we work with that can actually pull up the eligibility and tell us prior to you receiving notification. Once you have received an approval, there is an additional step that will need to be taken. In 2014, since the state of Illinois' financial situation is what it is, they've implemented managed care organizations who are responsible for managing your care. Medicaid will still be the primary default organization or the payer source, but most of the local hospitals will get paid from a managed care organization. 90% of the population has to choose a managed care plan. If you don't choose a managed care plan within a certain window, the state will choose a plan for you. I am completely opposed to this because no one knows your health benefits and needs better than yourself. So you may or may not get a letter telling you that you have to choose a managed care plan. And that's kind of where people fall in, have issues. So you receive the approval. You will then have 60 days from the date of the approval to choose a managed care organization. I've actually included some 3 of the plans that are available here in the Rockford area. There are a couple of other ones, but I'll tell you about the process with those. So you have to choose a managed care plan. Now, it is really important for you to consider the managed care plan that you're going to get into because you are locked into that plan for 1 calendar year. Unless you relocate to another county, you are locked into this plan. So in the event that research is not done prior to you selecting the plan, and you find 3 months in that your specialist will not be able to take this particular plan, you have to be referred out to another facility. So we've had people that constantly go into Chicago because the research wasn't done, and there's a multitude of reasons why. I won't bore you with the details, but so you're locked in for a calendar year. There is also an anniversary date. So within that short window of time, you have an opportunity to select an alternate plan. So as following the sheet that I provided, so once you get the approval. Now, there are people who you might be thinking, well, what if I don't qualify for Medicaid? What then? You can still be considered for a program that they have for select individuals who make over the income threshold. That's called the Medicaid Spend Down Program. And so for individuals, let's say hypothetically, you are considered disabled according to Social Security standards. According to public aid, a single individual cannot earn over $990. If you earn over that, you will be considered for a spend down account. So anything over that would need to be paid into a spend down account to public aid. we can go into that, or if anyone has any questions, we can definitely delve deeper into that, because that can be a little bit confusing. So again, we have some information about the managed care plans. They are the first point of contact in the event that you have any issues. If you have to see a specialist, they have a network of facilities that you can refer to within their network. They will pay, some of them will pay for you to go into Wisconsin, so that's a plus. You don't have to necessarily stay in Illinois. So here I've listed some of the managed care plans that are available. Health Alliance Connect is a new one, but they're also the unique area at the end of the year. And also you might see Community Care Alliance. Community Care Alliance is very selective. You are unable to choose Community Care Alliance. Community Care Alliance chooses you because you're typically someone who have a lot of medical issues that need to be addressed there. So you're a special population of individuals. Once you are approved for Medicaid, you have to do what's called a redetermination every year. Again, forgiving the state, they've actually been kind of lax on that, and they've not been providing a lot of the redetermination forms, and as a result, people are terminated, and they don't know until they go to the doctor or until they go to the pharmacy to retrieve their medications. So we're trying to figure out a way that makes it a lot easier for people to obtain the necessary paperwork, get it filled out, and get it sent back into the facility. We have been accustomed to having our local office handle everything, but the redeterminations are handled in Chicago, so there's a little bit of a delay. And as a result of it being a delay, they're delayed in how long it's taking them to process those redeterminations. As a result, we have people who don't have coverage. I think they don't have coverage and they can't go to their doctors, they can't afford their medications, and then of course we see a lot of complicated health issues as a result of that. But in the event that that is the case, Crusader has gone above and beyond to try to help consumers, even if it's just a short window of time where you kind of have that window where you don't have coverage, but you need your medications, or you're just waiting and you don't know what you're going to do. So don't not go to the doctor. So just use us as a resource in the event that it's needed. So I did provide the number for the.
Can you tell how we can use you as a resource in the event that it's needed?
Oh, sure.
When you say that.
Yes. So if you find that you are in need of medical services, your doctor won't see you because you don't have any insurance, or you're not able to get your prescriptions filled, you would actually be able to refer to Crusader. We would schedule you to see one of our providers. Our providers would then rewrite the prescriptions that you're currently taking. Then if you're someone who has a financial constraint, you're not able to afford your medications, we have a program where we would actually be able to offer either a discounted rate for those prescriptions or provide it to you for free until your Medicaid is reinstated. So it is a little bit of a process, but we are trying to work diligently to ensure that people don't have to go without their medications, because we do understand and know how important your medications and your health are. Okay. All right. So then, and then lastly, Healthcare.gov. So, as some people refer to it as Obamacare, but everyone needs insurance. I work at a medical facility, and we see the worst of the worst. And I am an absolute, I completely believe in Healthcare.gov. I mean, I won't tell you, African Americans, we are so susceptible to so many illnesses, chronic illnesses. We don't really take care of ourselves. And so, we need this. We absolutely need this. So if an individual is working, let's say I do see a lot of people that work over at Servicom, and they get a lot of incentives and bonuses for being on time and helping consumers, so they're not eligible for Medicaid. So what I typically do is try to refer them to the marketplace. The marketplace is open November the 1st to January the 31st. There are special times throughout the year that one will be eligible to go on their special enrollment periods if they recently lost coverage or suffered a life-changing event. During open enrollment, what we do is we come together, we put the information in, we create an account that is all yours. You control it, you do with whatever you need to do with it. We go on, we plug the information in, and then we take a look at the plans that are available. Now this is private insurance, so you will be paying a premium. There are out-of-pocket expenses, but this one is Healthcare.gov, of course, they have their glitches, but it's very user-friendly. You can go on there to see what medications are considered on the formulary, which will be covered. You'll see if your doctor is in network or to be considered out of network. You can go on there, there's an explanation of benefits. I call the insurance Bible because it tells you what a premium is, what an out-of-pocket is, within the network is. I mean, there's a lot of information on there. They tell you percentages that you will be responsible for paying, co-insurance. I won't bore you with the details, but it's very user-friendly. In the event that you're not comfortable doing this, you can definitely reach out to us and we'll definitely be able to walk you through that process. Even though we put your information in here, you do not have to purchase the plan. If you find this too expensive or you really can't afford it, there are options that are available to you. 90% of the individuals who apply for the federal marketplace are eligible for credits, which can offset the cost of your monthly premium. So again, in the event that this is something that you need, again, we will walk through this. I will hold your hand. We will take baby steps, and then I will speak in terms that you understand. Because sometimes insurance can be overwhelming, So again, you can at your leisure just go over this information. Again, it's information about the plans, things to consider when you're choosing insurance. And again, a lot of this is kind of tailored towards Medicaid. But again, even with private insurance, even with Medicaid, Medicare, just some things to think about, like what's important. What are you looking for in a managed care plan? What are you looking for with insurance? What happens in the event that I can't afford something? What are my options? So again, at your leisure, a copy of my business card, email, and phone number is attached, just in case you have any questions. If you have friends and family members who have Medicaid and have to transition from a plan that has recently left the area, don't hesitate to give us a call. And again, this entire process and service is absolutely free. Any questions? I said a lot, sorry.
I have a couple questions and then I'm gonna, can I have Medicare and Medicaid?
Yes, you can. You can have Medicare and Medicaid. Medicare would always be the primary. Medicaid will supplement or follow up with that. And additionally, Medicaid will pay your Medicare premiums.
And in most cases, when someone is what we call dual eligible, Medicare and Medicaid, really the only other thing you may need is a prescription plan. But when you're Medicaid eligible, you would also qualify for what's called extra help through the federal government that would reduce your Part D costs or your prescription costs. So I always tell people, if you have Medicare and Medicaid, don't let anybody sell you a private piece of insurance. Nothing makes me crazier than to see that, because you don't need it.
Can I have Medicaid and the private insurance?
You can, but again, it's exactly, you have to sit down and then again, based upon the income, you can have Medicaid as a supplement, but your insurance will be primary. So yes, it is possible.
Okay.
That's directed to Ms. Melinda. I want to say, I met you at the Purple Tea earlier this year.
Yes, hi.
Hi, and you gave me your card, and I was able to get your card to an employee. I did with the Health and Safety Department at UPS, and I referred this employee to you, and you were very instrumental in helping them get the information they needed, even though they had UPS insurance. You helped them in other ways. So I want to say thank you, because they came back to work and ran a parade about how patient and throwing you over them. With that being said, I'm not trying to make my job easier, but if I can get some more of your business cards from everyone, so I can, pass them on at work. If I have a question, I can straight directly send them to you. I would really appreciate it. So I just want to say, had a wonderful compliment from someone.
Thank you, I appreciate it. And sure you can.
Okay, this is for Ms. Melinda. If someone went to the Healthcare.gov to put their information in, and say for instance, it's a retired, the man is retired and the wife has no income, she puts, because he has benefits covering him, she puts her information in. As far as for the income part, is she putting just It's for both of them. She's putting his income in.
Correct.
So that'll determine how much she would have to pay.
Correct. So when you go and we create an account, we put all the income that's coming into the household. And so based upon, again, it's income based. So since it's two individuals, they'll be allotted. Their income threshold will be a little bit higher because it is two people. In the event that they find that your income is such that you don't qualify for Healthcare.gov, they'll transfer that information to Medicaid, and Medicaid will then process the application, and then they'll get follow-up information for Medicaid.
Specific information regarding spin down.
Yes.
There's some family members that can go through that and all that. A little bit more discussion about that. You know, there's some members who've been like 59 at stroke or so, and we're talking spin down. Is there anything we should ourselves to spin down to the point, you know, where I think you can only have a certain income after before you qualify for Medicaid. But something that point about that in my life now. I've heard about spin down, and I'm kind of uncomfortable with that.
It is very confusing. I'm not going to sugarcoat it. But again, you have to, based upon your income. So I had a gentleman that I was speaking with. He had a little over $1,300. So because he was considered disabled, then he would have to pay into this account. He had, I think it was $370 or something. And so he and I kind of went back and forth because he said he wasn't able to afford it. You don't have to have the spend down account. It just assists him because he had Medicare. He had Medicare Part A and B, but he needed that additional assistance. And sometimes it's not feasible. You just can't afford a spend down account. So if you have that dual eligibility and it shows that Medicare, your spend down account is unmet, then the only thing that the facility can bill would be your Medicare Part A and B. So you would still have some out-of-pocket expenses involved with it. But then, like I said, you would definitely need to determine whether or not it would be feasible monthly for you to have and to pay into the spend down.
So my experience with spend down, and it could have changed because I'm a little outdated, was that people didn't have to pay into the spend down, but if they had enough medical bills that added up to their spend down amount, they might only need to spend down a couple times a year.
Correct.
Based on the medical bill. So they didn't necessarily have to pay them, they could submit them, and they could be counted towards the spend down. Does that still work that way?
That is still applicable. It is definitely true. But it's just the delay in that whole process. But yes, that's true.
This is the opposite side of the coin. This person here had a hemorrhagic stroke and had almost $1 million and qualified to be in a facility. So they're saying, okay, spend down.
Yeah, that's definitely different. I would definitely, give me a call, and then what I can do is I can actually see if I can reach out to a specific worker and see if we can look at this person's particular case, and then see what they'll be able to do. And in the event if they had to continue with the spend down account, I'm not really sure, but we'll see. It's worth a shot, taking a look at it.
And that sounds like possibly somebody who needed nursing home or skills. So that is a different situation than the spend down and what you have to pay. Which we could set up another session, right?
So thank you for this information. It seems, as I was listening to you speak, that there are some possible bumps or gaps in the system as a structure, but then there's some gaps that are a result of the fact that Illinois is just broke.
Yes.
And so I'm wondering, because I heard, if I heard you correctly, when you apply for Medicaid, it's 45, takes up to 45 days. And then once you're approved, then you have 30 days within which you're supposed to choose a managed care organization?
I think typically 60 days. But
60
then,
days.
Yes, but then again, based upon the individual, we find that there's a small percentage of individuals who do not have to choose a managed care plan, and they would have strictly Medicaid. But again, because the state, we have a lack of knowledge. We have a lack of people informing consumers of what they're entitled to and what they're eligible for. So they won't know whether or not they have to choose a managed care plan or whether or there is a delay there, so.
So that's where I was,
Yes,
right there
yes, there you
is
go,
where
yes.
my concern was, and that is, if you hadn't come here and we weren't hearing this, basically, so the people wouldn't know that they needed to get a managed care organization until they went to the doctor and found out that, oh, you didn't do.
Exactly. Well, they'll go to the doctor and they say, well, you have Medicaid. You have to choose a managed care plan. But then this person would have to try to figure out, well, what does that mean? Or you go to the local office and they'll tell you, well, you know what, go to Crusader, and they'll choose a plan for you. Because the state is supposed to inform consumers. They're supposed to follow up with letters, but
Okay.
it's
So
not.
I guess my question then is there somewhere, whether it be online or somebody has a brochure, where everything you just talked about in terms of, and I appreciate this, and I think I'm understanding you, but man,
In layman's terms, where could you
yeah, I'm trying. I consider myself a good listener, and I'm getting lost, and I don't need it yet. So I'm like, man, if I was under duress, I don't know what I would do with this information. I'm wondering if there's like a flow chart somewhere that says, okay, this is where you go, and if this, what I'm trying to say, is there a simplified something somewhere online, or is there some office where you can go to and you can try to follow it out, or do you just basically have to know good people who are willing to sit down and explain it to you?
Yes, the latter. I've tried to, as much as possible, try to put, this is just a snippet. And again, I try not to overwhelm because there's a lot that goes into it. But again, there are facilities, I think the health department on 555 Church, they also assist with selecting managed care plans, but I am primarily based at the West End facility, and I am also at Loves Park, but then we have representatives at Broadway and Belvedere. So call Crusader and say, I need help with insurance, and they'll know exactly where to direct you. If you have friends and family members, even if we have to be nosy, do you have insurance? Let's get some insurance, because we don't know what's going to happen in January. And so that's very scary. So, but to answer your question, no, it's not. We do refer to a website called Enroll HFS, and that can be a little overwhelming at times for individuals to go in there to see whether or not they have a managed care plan or see if they can enroll in one. And so if you're computer savvy, I could possibly put together some websites. I'm not, but again, it's just one of those things where people are not comfortable or they don't know where to find the information. The Department of Human Services, they have a lot of information on there if you have time, like half a day to go through all of the information on there. But, I mean, panels, discussion like these are wonderful, and that's why I try to do as many outreach events as I possibly can, just to get the word out, just to try to get people to understand this is what you're entitled to. When you do have a managed care plan, call them, complain. If you have an issue with a provider, call and complain. If you can't get to your doctor's appointment, call. They have transportation. They only require you to do a 48-hour window. Call if you have medications that you absolutely need. Like, there are times where you need to get a prior approval. Not impossible. There does create a delay, but absolutely do the research. See what's important to you. See what they're offering you, and then kind of say, okay, for that year, let me try them out. But yeah.
So there are a couple of things that maybe I can work with you all on, and we could put together that flow chart that Pastor is talking about. But some of the things that I think that might be helpful is for all of us to identify our anniversary dates for our insurance. Find out when our time for re-enrollment is. Whether it's private insurance on your job, or it's insurance through Medicare or Medicaid. So then you can be proactive, maybe 60 days prior to that, and start preparing for it in the event that you are one of the people who get slipped through the crack and you don't get notified that you need to re-enroll or that there is managed care. Or maybe you're even one of the people, the managed care program you were in left the area and you were not placed into a new managed care plan. So you can kind of be proactive, and in the event that you're caught in that cycle, then now we have Melinda available, and she is willing to help individuals with that gap. So Crusader is a wonderful resource in our communities, and since they are willing to see people in the interim, it may not be your forever doctor, but for now, to make sure that we as individuals are not missing appointments with seeing doctors and going without our medications when they have made provisions to help us. Now, we as a parish health ministry and as a church, we need to help each other out, and our seniors and those who may not be as savvy with that process. So if I start getting your business and asking you some questions, it's only to help you, because it can be a very challenging process to try to go back, because if you miss those deadlines, then you have to wait an entire year before you can enroll into another plan. So you want to be proactive and choose the best plan that's for you versus having one that is selected for you, because it may exclude your doctors. And then all it takes is a few minutes to call your providers to find out if they accept your plan. So that being said, I want to transition to Antoine and let him talk so we can hear from him, and then ask a few questions. And I know that they have lunch prepared for us. So.
Is it afternoon? Good afternoon? Close enough. Yeah, I'm Antoine George. I'm the HealthWorks coordinator for Winnebago County Health Department. And we basically do medical case management for DCFS children. And I did want to ask this first. Everyone in this room goes to church here? Attends church here? Okay, good. Because they had a revision in the security measures at the building, in which we can't access it on the weekend anymore, and so my business cards and brochures, which I'm used to going to get before I have to do, foster parent panels and such, I usually would go get them and then go to the facility. Well, I couldn't do that today, but since everyone goes to church here, I can come back and leave them with Dorothy or Pastor Copeland, and so you can have the information. But basically, what I'm going to talk about here is just, it's all directed towards foster children. So, if you happen to have a child that you are in care of that was taken into DCFS custody, and as it relates to medical insurance, there is the DCFS medical card. And so, the child may have already had a primary care provider before being taken into custody, or managed care plan, as was talked about. Well, once the child is taken into custody, they can go to the primary care provider, they can go to the managed care plan, but it doesn't matter anymore, really. They don't have to do that. So, for example, a lot of the foster parents that I deal with, they go to Crusader Clinic to get exams. And what happens is the child, once they're taken into custody, within 24 hours they have to have an initial health screen, called IHS. It's within 24 hours. And they're really diligently investigators with DCFS in making sure that the child is treated within 24 hours. After that, the child is placed, whether it's someone who signed up for the program, so if you're a foster parent that went through the actual training, thank you for your services. If you are a relative placement, meaning, a brother or sister, had children, and all of a sudden you received a call at inconvenient hours of the night, then you know that your brother or sister's children have been taken by DCFS. That's a little different, and it can be very stressful in trying to deal with the process of trying to figure out what to do next. Obviously, DCFS has things that they do, and they fund us, and so we're just, they actually pay us. We're a component of the situation. But however, from where we sit, what we can do is assist with finding a doctor. So, if you're trying to figure out where to take the child, because within 21 days after you take the children into your home, they have to have another exam. That follow-up exam is not only to make sure that, whatever the issue was that got them taken from the home is resolved, but also to cover you as foster parents and say, this is how the child was sent to you, and making sure that the child is not worse off, so to speak, before they came with you. And so the issue becomes again, because again, if it's relative, it's like, okay, I just got this child overnight, my life changed completely. I didn't have kids, and all of a sudden I get a call, I have children with me, or a child. And so, from where we sit, we just try to at least help the process of finding a doctor, making sure that they take the DCFS medical card, And, you know, the field, at least as it pertains to HealthWorks, involves more women than men, a lot more. I think I'm like 3 of 100. The only reason why I say that is because I believe that they put me in the position because they wanted someone that was going to go to the medical provider places and be a little bit more stern, aggressive, maybe even angry. Because here's what happens. There's a culture to DCFS children in which the medical providers don't want to treat. They treat them like welfare cases and things of that nature. And so me, I go to the medical providers. You know, I might call once. If I don't get what I need once, I'm driving, I'm getting in my car. And it's not to, you know, be mean. Hopefully I can just have a nice, simple conversation. But there's times where we have to, you know, mention things over and over again. And I don't want the foster parents to have to bear that burden. That's what I get paid to do, and I take it very seriously. And so there's been times where and let me say this, I oversee 9 counties. So that's and I have to listen, but I think I can say it. We got Boone, Carroll, DeKalb, Ogle, Lee, Stevenson, and Joe Davies is combined. Whiteside, I think I covered all, and of course Winnebago. Winnebago has the highest by far. And so I go to hospitals in all of these areas. I do foster parent pride panels, which is basically foster parent training in all these counties. And also I have to train DCFS investigators and caseworkers in all of these counties because they get a training from DCFS as far as, you know, whatever, you know, they do as far as, you know, placement, casework, because they're only HealthWorks eligible from 0 to 5. Once they turn 6, they age out. But that does not mean that we stop assisting you. So if you're a foster parent and your child has turned 6, you can call the caseworker, but just understand they're dealing with new cases coming in, they're dealing with taking new kids, going to court dates and things of that nature. And so we take that off of them as well. So if you're just trying to call to find a doctor, or it could be specialty care like OBGYN or something that's you know, non-routine. So you give me a call, and then my staff, I have 3 people that work under me, and they work very diligently in making sure that foster parents get to the, what they call the follow-up appointment. It's also called the CHE, Comprehensive Health Exam, but also finding other facilities that may, the child may need treatment at. We call the DCFS guardianship office for anything that's non-routine. And we also send over what is called consent to treat forms. I know all too well. And so, for example, if you go to a doctor and they haven't seen the child, and again, you can take them to any doctor, and they need what is called a consent to treat form. Legally, a doctor can't treat a DCFS child without this form being signed. It really just consists of a very important signature, Deborah Dye Webster at a DCFS office, and the name and the date of birth and the place that the child is going to. We fax them over all day long. Crusader, for sure, all day long. And so, not only that, I took notes while I was kind of sitting here. We also set up WIC appointments. So if you call and you know you're like, okay, I just got this child, I don't know what to do, and that happens all the time. They even ask us, you know, when do I get my check? I'm like, when do I get mine? DCFS pay us too. But because they're told all these things in the midst of all this just to try to ease their mind. And you know, I had to actually sit with an investigator and watch them talk to the pride panel, the foster parents, to really get an idea of how stressful it probably is to go in someone's home, take children, then place them in the relative care, and now all of a sudden they're trying to figure out what to do next. And they're telling them things, you know, like, you know, well, you get a stipend, like I guess the money is going to ease their mind. And I'm just being honest, this is how it goes. And so I'll tell y'all this because it can happen to anybody. You know, one day you're just sitting and chilling and life is regular, and all of a sudden you get a call at 3 in the morning. That's how it happens. And God forbid it happens to anybody here or any, you know, but every day I come in and I see new cases on my desk. People I know. I'm not judging. It happens because sometimes the cases are, you know, it's not always abuse and neglect. Sometimes it's an argument, you know, it's not. And even then, it is abuse and neglect. My thing is to do my job as the HealthWorks coordinator. And my job is to make sure that you guys take the child to another doctor, get a follow-up appointment. It's called interim medical case management. So for the first 45 days, we are really hands-on. After that appointment, you receive a health passport that shows all the medical treatments the child has received since they've been taken into custody. And then once that's done, you will be contacted every 6 months by our medical case manager, her name is Jeannie, to do ACR, which is an administrative case review. So it's every 6 months, and they basically just trying to find out what the child has had to go through as far as medically in the past 6 months. If it's a baby, you're definitely going to have a lot of visits, well child exams and things of that nature. And so pretty much that's my focus when it comes to the medical portion of it, is just making sure that, if you want to take the child somewhere, that I will call. And I don't want to put that burden on foster parents. Sometimes they'll call themselves, and that's fine. But you don't have to do that, because we understand in HealthWorks that it changes their life immediately. And so we try to make not only the foster parents' job or duties easier, but the caseworkers, because they're dealing with kids every day, the investigators. And so we're here to just, be that, that entity that makes sure that the medical part, we just collect the records with a master file. So even if it's in a different county, obviously 9, we get the file first, we make the copies, we send it to those counties, and then they keep up with it until the child either is adopted or ages out. Now, once they're adopted, that is no longer foster care, that's your child. There's a difference, so I want to make that clear. Now, if I know you, I'll probably still help you with HealthWorks, but I will, when people call and say, well, I adopted this child, there's a scope that we have to work within. And so then I'm stepping outside of my scope. At that point, that's your child, you're the parent. And so, so that pretty much is the, but again, we don't try to shut anyone out. I still like, if I can refer you to someone, I'm not just going to hang up the phone or anything, but I'll definitely answer questions and see if I can, forward you to the person or the people that can help you best.
We have questions? So if a child goes into DCFS care and they have private insurance, do they get a DCFS medical card and use their private insurance?
They're just medical card at that point.
Okay.
Yeah, just.
So if I'm a foster parent and I take a child who has some medical conditions that they were previously treated for when they were with their parent, and they already have specialists or whatever, will that medical card still cover those
Yes,
services?
it should. It's just sometimes it's just hard to find an actual doctor that will do the treatment. So it may just, while they're on the card, so it's just a matter of calling around, which could take a day. I mean, and I will call and I will go there. And that's fine, for me, because HealthWorks has been something that wasn't taken so serious, and a lot of people don't even know about it still. And I think that the whole goal of, the position I took, she retired. And I think the whole goal, once they started moving forward, was to make HealthWorks more visible in the community. And so, because they see, that I'm there on behalf of a program that really needs to be recognized. And these children they didn't ask to go through whatever they've gone through. And so, just making them understand. I've even had to use analogies and stories that, I can't be specific, obviously, but just to make them understand, what if that was you or a child you were related to that went through that. It's the child that has to really bear the biggest burden of it all.
Okay.
So.
Are there any lasting questions? I know that our lunch is prepared for us, and the panelists, we hope that you will stay around and have lunch with us. We do appreciate your time and your expertise. And I encourage you all to call on people, because I definitely will. So you tell me I call you, I'm going to call you. And if I can say I can send people to you, I'm going to send people to you. But we can't keep this information to ourselves. We definitely need to share with other people so that we can make life easier. Because it is difficult navigating the healthcare system alone. And when there are individuals in the community who are willing to assist in that manner, and that's their expertise, let's utilize them and allow them to serve in that capacity. But are there any parting questions? So I hope you will stay. I know that they have baked and fried chicken and some calico beans and coleslaw and lemonade. So it's a nice hot lunch that has been prepared. You have a question? Okay.
Hi, Melinda. I just have a question about, if your insurance don't provide your medication for you, where do you turn to? I know you said something about coming to Crusader Clinic, but I'm not with Crusader Clinic. I'm with St. Anthony, and it's been maybe 3 or 4 times now that I need this medication, but my insurance provider has not been able to provide it for me because they have a problem with that, and I'd like to know what is the reason for that.
Does the term prior approval, does that sound familiar to you? Prior approval? Do you need to get a prior approval for the medication?
And basically, the doctors, prescribing, they send it to the pharmacist, and then later on, the pharmacist said, was an issue with the insurance, so
What insurance do you have?
I haven't really.
Okay, so thank you. Just remember that they have stated to us that you do not have to be affiliated with their organization for them to extend it themselves to us. So
Taking this time for us, and this, thank you. So, everybody, remember how we had the emergency? I to do ideally, and I'm thinking out loud right now, is figure out some kind of tickler system so that those of you, once you get your anniversary date, whether it be for private insurance or through Medicare, Medicaid, whatever, get your anniversary date for your coverage, and then we as a church, if you got an email, we can send you, it doesn't cost nothing, we can send you an email reminder, or if you're not on email, we can get some little postcards and have you address them to yourself, to remind yourself in your own writing to take care of this business. The bottom line is, since we know that the state is broke, and since you heard that even on a good day, there's gaps, that means you got to take control of your health, and we got to figure out how we can help one another. So the easy thing we can do right now is, everybody check out, go through your paperwork. If you need some help, contact the parish health nurse ministry, and we'll figure out how we can help you get the information as relates to your anniversary date. And then we want to catalog it. That's not a, what do you call it? That's not a HEPA
Violation.
That ain't nothing. Then, hey, just remind me on such and such a day to take care of this business. And we can do that. So at least we got that part covered. And then we'll brainstorm about trying to figure out a way to make a schematic or some kind of flow chart or something. Because, man, I'm working on a degree. I can't hardly figure out which I'm talking about. And I'm straining to listen. So let's figure out how we can get this thing worked out. So I'm going to bless the food right now. Then if I'm not mistaken, it's in the multi-purpose room. You just go straight on out and let's go and eat. So, Father, thank you for hearing and answering our previous prayer. You let us hear what we needed to hear, and now help us do what we're supposed to do. Thank you for our friends. We pray that you multiply back to them the time and energy they poured back into us, that you give them favor in everything that they put their hands to do. Now, thank you for the food that's been prepared. Pray that you bless the food and bless the fellowship as we eat. In Jesus' name we pray.